Hello everybody and welcome. Today we're going to discuss the importance of obtaining what is known as informed consent, a crucial part of any procedure. If our patients are going to agree to a procedure that we are recommending, they must be informed and they must be able to consent.
What is informed consent, you may ask? Several different medical and ethical groups have formulated their own definition, but the American Medical Association accurately and succinctly defines it as the process of communication between a patient and a physician that results in the patient's authorization or agreement to undergo a specific medical intervention. In short, it involves explaining to the patient what a procedure entails and the patient agreeing to go ahead with the procedure. We'll get to some of the specifics more in just a little bit, so stay tuned. Let's take a step back and discuss why informed consent is so important. First of all, obtaining consent is important for patient safety and quality of care. As we'll get to shortly, part of the informed consent process is explaining to the patient the risks of any procedure and the interventions used to help minimize those risks, such as using the sterile technique to minimize the risk of infection, or utilizing an ultrasound machine to minimize the risk of damaging surrounding tissues during the procedure. Obtaining informed consent is also the ethical thing to do. If you recall the 4 basic principles of healthcare that we learned while studying for Step 1 way back when, one of those principles was autonomy. The patient has a right to consent to any form of treatment before that treatment is implemented. There are several examples throughout history where patient autonomy has not been honored. Perhaps the most notorious of these examples is Dr. Mengele. Dr. Mengele was a Nazi physician who used inmates at Auschwitz for human experimentation. The experiments had no regard for the health, safety, or physical and emotional suffering of the patients. The horrors surrounding his experimentations are important reminders to us all that patient autonomy is a fundamental right and should never be superseded by physician authority. Finally, another reason that informed consent is important is because it's the law. Always remember that obtaining informed consent is the provider's legal responsibility. Granting informed consent is the patient's exclusive right. Okay, so we know that informed consent is important, but whose job is it to make sure that informed consent is obtained? Well, at the end of the day, the buck stops with you. It's always, ultimately, the responsibility of the physician performing the procedure to obtain consent. Now, that's not to say that nobody else can play a role. In fact, contributions from the entire clinical staff, including nurses, other physicians, medical students, etc., can be helpful in ensuring that consent is obtained and that the patient understands the risks and benefits of the procedure. All right, let's move ahead and get into the nuts and bolts about what makes up informed consent. First, discuss with the patient the reason he or she could benefit from the proposed procedure. It is also important to provide a description of the proposed procedure, being sure to use language that the patient can understand. It is imperative to discuss the risks and benefits of the procedure with the patient prior to performing the procedure. You can also inform the patient about alternatives to undergoing the proposed procedure and also educate them about the risks and benefits of the alternatives. Finally, be sure to discuss with the patient the potential risks if they choose to not undergo with the proposed procedure. This next slide lists some of the possible barriers to informed consent. Take a look over it and be aware of possible obstacles you might encounter with your patient. Don't forget that there are several tools at your disposal to help you overcome these hurdles. For example, if there is a language barrier, there is a language line available 24/7 that will help you obtain consent prior to performing a procedure in the patient's given language. Now, there are several instances you will encounter where a patient is not able to consent to a procedure. These instances include if the patient is altered or delirious, if the patient has dementia or other cognitive impairments that prevent him or her from being able to fundamentally understand the risks and benefits of the procedure,
and if the patient is too somnolent or obtunded to consent to the procedure, and in most cases, if the patient is a minor. For minors, in most situations, parents can give informed consent for treatment for their minor children. In most cases, a mentally disabled person or a person with advanced dementia has an appointed guardian that's authorized to make medical decisions for that individual. Medical providers need to make sure that when they obtain informed consent for incompetent individuals or those with severe dementia, they have obtained it from the correct person or persons. In situations where the patient is unable to consent to a procedure due to an acute change in their mental status, and they do not have an appointed guardian or POA, Vanderbilt and the state of Tennessee typically allow for a, quote, next of kin to consent for all of the simple bedside procedures that we will be discussing in this course. In our state and at Vanderbilt, we have laws and ethics protocols that designate levels of authority given to the, quote, next of kin family members. Those designated levels of authority in order of precedence are first to spouses, then adult children, then parents, then siblings, and sometimes sibling decisions may require a majority or unanimous vote depending on the decision at hand. Keep in mind that any ambiguity or conflict should provoke a discussion with our ethics consult service and risk management at the earliest opportunity. When next of kin is asked to provide consent, be sure to include on the consent form who is consenting for the patient and their relationship to the patient. If no family members are present or available, consent can also be obtained over the phone. Be sure to document these phone conversations appropriately with a witness present to the phone conversation. In these situations in which a patient cannot consent and no suitable guardian or family is available, it is important to remember that if the procedure is a medical emergency and the procedure is in the best interest of the patient and delay in the procedure could bring about harm to the patient, then you may proceed with the planned procedure without informed consent. Be sure afterwards to document that the procedure was a medical emergency and consent was unable to be obtained prior to performing the procedure. And finally, just remember that obtaining consent prior to performing a procedure is not only your professional and ethical obligation, but your legal obligation too. It's all about the patient's safety, guys. Now that you know all about the key components of informed consent and how important it is, get out there and start consenting.